Namaste everyone. Welcome back to our live stream sessions. So today I'm explaining, or I took a session about the autism awareness session. Why? Because as we all know, in this last week, that is April 2nd, the day was celebrated as Autism Awareness Day. Why this day was celebrated, and what is the motto of this awareness, and what is this autism, I'm going to explain today. Because especially why they created as a April 2nd has a autism awareness day, because this is autism is one of the disability, or the what to say, disorder in a children. Why they created this awareness is especially because as this is a one of the disabilities, it is not a disease, or the main complaint other syndromes we have. It is one of the disability, that's it. So our parents will not be aware of this, first of all, because as it contains only delayed milestones, so our parents will not be aware of this disability, so they delay or ignore to treat this, or they will not be comfortable to diagnose this as their kids are autism kids or autistic kids, so they will lack in diagnosing the disease. So after long days of, or after the older children, they will diagnose it, and it will be the risk factor, or the hard side to treat the disease. As we all know, this there is no fully cure of this disease, but we can give a supportive treatment for this disease. So to aware the parents about the disease, and what are the symptoms, and how can they can diagnose the children, they created this autism awareness day. So it was April 2nd, we consider as a autism awareness day. So why this awareness? Its purpose is to promote, protect, and ensure the full and equal enjoyment of all the human rights and fundamental freedom by all persons with disabilities, and to promote respect for their inherent dignity. Though they have delayed ability to diagnose, or delayed ability to have the milestones, delayed ability to concentrate, but they too should have a equal respect and equal uh, positions, or equal rights against the human tendencies, right? So to create awareness about this, they created this autism awareness day, or autism awareness week. Early identification of this autism spectrum disorder is important, so children and families can attain the services and support they need as soon as possible. As I said, it's very difficult to diagnose, because our parents will think that maybe my kid will get the milestones delayed, or the slow progression of milestones is there. And one thing, and another thing is, our parents will not expect that, accept that their kids are autism kids, so they will delay in diagnosis, and also the treatment will be delayed, so the kids will get more problem in treating the disease. So in this awareness, we will create the symptoms or clinical causes, and how the kids will be, so that they will get treatment as soon as possible. So four types of autisms are there. Which are those? Autism spectrum disorder, or Asperger's syndrome, childhood disintegrative disorder, and pervasive developmental disorder, not otherwise specified. These are the four types of autism which we can see in a children. First of all, what is this autism? Why it will be caused? This autism is a condition, a serious developmental disorder that impairs the ability to communicate and interact. This disorder impacts the nervous system and affects the overall cognitive, emotional, social and physical health of the affected individual. So what is this? Especially it is related to the nerve system. In this, no any like particular milestones or particular system of our body will be affected. It will affect especially nerve system, and this nerve system, what it will create? It will create the effects in interaction or communication or orientation or social behavior. These all will be hampered in a kid, so that the kid will be having difficulty in orientation, or kid will be having difficulty in communication with others. And more than 1 million cases per year in India are noted by the autism disease. And treatment can help the individual child, but this condition cannot be cured, and it can last for years, or it can be the for the lifelong. The treatment, whatever we treat, will be for supplementary, like supportive system, but the treatment will not be cured fully. One thing, it may be years together, or it may be for lifelong with the supportive treatment. Well, so we came to know what is the symptoms of this autism, and what is this autism. Then we specific symptoms that our parents can diagnose the disease in a early stage. What are the symptoms of this autism? That is difficulty with communication and interaction with other people, especially rather than our home people, because in home people, however, the kid will be from beginning, so the home, like mother, maybe father or any grandparents, they can understand the actions of a baby. But with others in early stage, the communication will be difficult of with other people to a baby. And restricted interest and repetitive behaviors, one same thing the child will repeat, maybe the actions or activities or words, anything. And the how our childrens will be, they will be interested in many activities or many things, right? But these baby will not be interested in many things. They will be restricted for some point or some activities. And symptoms that affect their ability to function in schools, works, or other area of life, rather than their daily routine life. Other activities will be restricted or affected in the individual's life. And not responding to their needs is one of the orientation, lack of orientation. And avoiding eye contact will be present. Usually this avoiding eye contact will be common in smaller age, like before 6 months, right? After 6 months, when we call their name, they will react, they will orient us, or they will communicate us. But in these children, this responding to their names or eye to eye contact will be absent, and getting very upset if they don't like any smell, or if they don't like any sounds, or if they don't like any tastes. Obviously these things all kids will do, but in these kids, especially when they didn't like any sound or any smell or any taste, they will react very hard, like shouting loudly, or banging their heads to the walls, or the awkward behavior, we can say, if they didn't like anything, or vice versa, if they are very happy with something, they will overreact. They will not be a just responder, they will overreact for that. And repetitive actions, movements, such as flapping their hands, or flicking their fingers, or rocking their body, these all activities will be present. Maybe repetitive, like banging their chest, maybe, or banging their hands, or cutting their fingers, anything. They're like repetitive actions, which you say, like maybe the babies will be like stubborn. If you say something not to do, they will do it repeatedly, and if you say to do, they will not do. obviously there will be like reaction will be opposite to your words and not talking as much as other children. Especially in some children, the speech will be totally absent. Only they will do the cooing sounds or other sounds repeat similar to cooing, but the speech will be absent till two, especially till 12 to 18 months. These cooing sounds also they will get in 12 to 18 months. Till that time, only they will react to the actions, and from 2 to 3 years they will get some monosyllables. In normal children, when we will get this monosyllables, that like ma ba pa, in six after completion of 6 months, right? But in these children we will get this monosyllables in 2 to 3 years, and some children will get their speech normal like simple sentences or bisyllables in 5 to 6 years, and in some children, depends on the stage of autism, the speech will be totally absent. They will not gain speech, only the actions will be their activity. So these all are the symptoms of this autism. So now we will discuss about the causes. What all causes may be which will cause this autism? Because for any disease or disability or any health issues, the main basic point will be cause. It may be a minor health issue or it may be the major health issue. The cause will be present. Due to that cause only we will get the diseases, right? So what are the causes for this autism in children? Having siblings with autism spectrum disorder is very common cause. If they have any siblings with the autism, then obviously the next kid have the chances of having autism kid only. Having certain genetic or chromosomal conditions may lead to the cause of autism disease, or experiencing complications at the time of birth, maybe the delayed labor, or maybe the stressful labor, or maybe the didn't had immediately cry after birth, or any complications, major complications at the time of birth can cause the autism disease. And being born for the older parents. Older parents means usually a woman, if she is pregnant after 30 years of her age, we will consider that woman has an elderly pregnancy. So if the both parents are older aged parents, if they had a conceived and they delivered in older age after 30 years or in male after 40 years, then it will be considered, or it may be the cause for the autism kid. So now we came to know what is this disease, what are the symptoms, what is the causes. Now we will discuss about the treatment. What all treatment we can give so that the baby or the child of autism can be sorry for the disturbance. So the child of autism can be treated. So first thing, as we came to know, we can't treat the disease fully. We can give supplementary treatment for the kids. And what are supplementary, like supportive treatment we can give to cure this or to handle this condition of autism in a children. So one thing is behavioral management therapy we should give. Obviously, more than a physician, parent's work is more here, because if we go to any physician or any hospital, we will be there for time being, means for 1 hour maybe, or if you get admitted for maybe few days you can stay, but 24 hours with the kid only a parents will be. So the parents role is main here to support a kid. How you support the kid and how you give the treatment, that much soon, as much as soon possible, the baby will pick up in its activities. So first thing is behavioral management therapy you should give. You should teach a baby in a patience way, that whatever the baby is reacting is wrong and how the baby should react. You should teach him or her. And cognitive behavioral therapy you should give, or early interaction or early diagnosis and starting of treatment is main here, because as the baby grow or has the child grow, it will be difficult to grasp them about the activities. So as early as possible you start the mm, treatment. And educational and school based therapies you can give, and joint attention therapy, medication treatment, nutritional therapy or occupational therapy, and parent medicated therapy, physical therapy, nothing but physiotherapy you can give about the movements, or social skill training and speech language therapy. These all are the therapies, especially nowadays as technology developed. We have the about these all therapies. We have particular schools or particular um, offices or particular organizations. So you can go through and you can have these therapies. And here one more point is, we have Autism Speaks organization. It was started from US, United States, especially for autism. Autism Speaks organization. This organization, even in India, they have some branches in particular places, and even in district voices for some primary health centers or some coaching centers or therapy centers are clubbed with this uh, Autism Speaks organization, and they will have separate sessions or separate therapy classes or separate schools for this autism or ADHD kids, because these kids, as we know, these kids they can't pick up with the normal kids, maybe activities, maybe schooling, maybe education, everything. So these all organizations have kept separate classes or separate therapies or separate sessions for these kind of kids. You can search around your area and you can go for the treatment based therapies for such kids. And coming for our Ayurveda, what our Ayurveda can give for this autism treatment? Obviously, Ayurveda have overall solution for all conditions. We know it, right? Because any illness in our body will be caused due to one or other doshas or dhatus or anything. The basic concept is doshas, right? So if we treat this, if we detoxify body and if we treat with the, now I'm not saying you should leave all the therapies and you should depend only on Ayurveda. With these all therapies, if you go through the Ayurvedic treatment, the result will be 100%, and the changes in a baby you can expect as soon as possible. What all Ayurvedic treatment you can give? One thing is detoxify body with the Shodhana therapy. Again, in Shodhana therapy, especially Shirodhara you can give, or Matravasti you can give, or the Shodhana therapy depends on the condition of a baby. Even Nasya you can give, depends on the complaints of a baby. You can go through the Panchakarma therapies, especially Shodhana therapies. After Shodhana therapy, give Medhya drugs, because as we came to know, nerve system will be disabled in this condition. Their Ayurveda Medhya drugs will act very wonderful effect in such conditions. So with Panchakarma procedure, give Medhya drugs, and with these both follow the therapies. What all therapies I mentioned according to your baby's condition, choose the therapy and you can go through the therapies. So this was the topic of autism. So parents, get aware of these, because even especially in villages, what people will do, parents will do, if they had any delayed milestone in their babies, they will think that his father got a delayed, it got delayed only, or their siblings, any siblings got it delayed only. So they will neglect or they will ignore a baby, that the baby will get its milestones later. We can ignore this. True, because Obviously, like neck holding, we expect the neck holding in 3 months, but some babies may extend till completion of 5 months also. It's not a problem. But the same baby, if didn't have neck holding after 8 months also, or after 7 months also, then it's a delay. So get aware of these and diagnose your kids' activities or orientation as soon as possible, because after 1 year, usually the baby will react to your questions, or the orientation skills will be developed, the communication skills will be developed. If you find any delayed activities in their routine, like behaviors or communications, go through your pediatrician once, identify the condition as soon as possible, so that if you start the treatment has in early days, it will give the result very soon, and the baby will have its normal activities as soon as possible. So to make awareness about the condition of the kids, especially about the autism, to parents, I prepared this session, and in the same way, the Autism Awareness Day is celebrated. So, if you have any still more doubts about this autism, you can comment in a comment section box. Thank you.